that public comment, if people are interested in coming in for public comment, you can, there's a link on our agenda page, and it takes you to our Tompkins County website where you will ask for permission to come to the meetings. Kathy Covert will send you a link to our Zoom meeting, and we will have public comment. So we're happy to be able to offer that. I know in the past we have done things a little bit differently. We've had public comment that's been available via email, but we've been able to increase our security standards, and we really wanted to just make sure that our information was safe and that we would not be Zoom bombed was our biggest fear. So I think we're comfortable doing that now, and we're ready to move forward. So I am going to ask our committee members if there are any changes to our agenda today. We see Amanda's here, and Glenn and Dan as well. And I don't see any changes to our agenda. And now I'm going to open it up for public comment. I know Mr. Lynch is here and has asked to speak to privilege of the floor. So Robert, why don't I turn it over to you for 3 minutes for public comment.
Well, good afternoon, Shauna, and I'd like to say hi to Lisa Monroe, my fellow Enfield leader, and welcome here. You're going to be familiar, Shauna, with what I'm going to talk about, as will Jason Molino. I prepared a few remarks. I'm here to respectfully urge that you add to your agenda and then adopt a proposed resolution that your legislature's Budget, Capital, and Personnel Committee will likely endorse tomorrow, and then forward to the full county legislature tomorrow night for a vote. And as it's worded, that would, quote, authorize county administrator to execute contract with Cayuga Health Systems for the continuation of community surveillance testing for Tompkins County residents related to COVID-19, close quote. I'd call that the 1/8 option because that's its local cost. It's a tremendous bargain for us. Under the negotiated arrangement, for every $1 we Tompkins County taxpayers would spend to underwrite local, free, asymptomatic surveillance COVID-19 testing at the Cayuga Health drive-through site, state and federal funds would pay $7. That's nearly 90%. Our cost would be just 12.5%. That's the 1/8. And even if New York State should back out of that arrangement, and Administrator Molino admitted last week that that's a possibility, the federal government through FEMA would still pay 3/4 of the cost. So they pay $3 out of every 4. I spoke at the last legislature meeting, you'll recall, about the urgent need for local free asymptomatic testing. I was presuming then full county funding, and that would be a heavy lift. But this is a real bargain by comparison. We can afford it. 7 outside dollars for every $1 we spend. Our fund balance is there for a reason, an emergency. And to speak the obvious, COVID-19 is an emergency. Universal surveillance testing is a real community need. Please craft a basic resolution and adopt it today. The wording need not be fancy, but this is a committee charged with public health. So speak to public health. Support the 1/8 option with your vote. Please do it today. Thank you.
Great. Thank you so much, Mr. Lynch, for those words. Is there anyone else that would like to speak on privilege of the floor today? Any public comments? Okay, I see no other hands, but I would like to welcome our human rights commissioners that are here today, and that will be one of our presentations. We have Ruth Yarrow, who's here. Pei Soyinka Ariel. Did I mess that up, Pei? Please correct me.
Really. You did pretty good, Shauna.
Okay.
Kathy was trying to get in, and so she should appear in a minute.
Okay.
She lost the link.
Oh, great. And Kathleen Bergen, thank you all for joining us today. And Gladys Bregman, who is the Human Rights Chair, could not be with us this afternoon, but the people that Gladys as well was instrumental in writing the statement are here. And again, that will be part of our agenda in a few minutes. As far as my chair's report, I actually do not have much of a report due to the fact that we're starting to get in the trenches of our budget, and I really want to make our meetings, our Health and Human Services meetings, pretty light. I know that department heads are gearing up to present their budgets to Jason, and he will come to us with a recommended budget. I really am not doing presentations like we did this time last year. I think the Zoom function makes it harder for all of us to communicate. And I don't want to put that stress on our clerks, our legislators, and of course, the people that are working in our county. So I want to be very, very aware of that. As far as our next line of business, County Administrator Jason Molino, can you provide us with a report, please?
Yes, hello, good afternoon, everyone. Thank you, Shauna. It's good to see everybody. Thank you for that. So I have some brief updates I can give you, and then I know Frank can follow up with any any questions. To just mention on Mr. Lynch's comments, we will have some information coming out to the legislature before Tuesday's meeting, giving a little bit more context with respect to surveillance testing for you to discuss and consider. So that'll be forthcoming. Excuse me. As far as on the COVID front, two things have happened just over the past few days. Some with some notoriety. Bowling alleys were allowed to open. Bowling alleys being a large gathering place at 50% capacity. That guidance was issued on Friday, excuse me. And then today, gym open in a week. There is some local public health authority in approving some of the portion of the reopening strategies. So environmental health will be working with some of the local gyms. That would include like the YMCA for opening their gym facilities again. So that's kind of new ground with some of the reopening and kind of some of the last reopening pieces that we've been getting a lot of questions on. We continue to work closely with our higher ed and our K through 12 partners as they're going through a lot of planning on a lot of different levels to try to be ready for their reopening strategies, all a little different. And I know Frank and his team have been busy 24/7 with that, with those steps and those processes. Some of the questions that I know have come up with respect to data sharing and results, testing results, numbers, those types of things. I know, and Frank can speak more intricately about it, we're working with Cornell and all the higher ed institutions on their type of dashboard that they're going to share with the public on their testing and how it's related to the results for students and faculty and staff because they're doing voluminous amounts of testing. And then we'll make sure that there's a differential and so that it can easily be interpreted both between our data, which would be more community surveillance versus Ed's data. So we've been working with them closely on that. Also, CMC did put out a dashboard off of their website to kind of talk about generally the testing that they've done in the region since March. And that has some basic demographics. And I know they're looking to expand the information, but this was kind of a first attempt at getting some information out there, and they'll build upon it as they develop it further. That's all the real updates I have, unless Frank wants to add to it any other COVID updates, but I'd be happy to answer any questions you have as well.
Great. Are there any questions from legislators? I see Deborah Dawson's hand.
Yes, thank you, Shauna. Sorry I was late. Yeah, I'm just curious. I appreciate the universities and the college having their own dashboards as a way of reporting their numbers. Are these going to be reported on the county's website and broken out separately, or how's that going to work?
So we're still figuring all the details out on that, but there will of course still be numbers reported on the health department's website. To date, all testing has been reported there. What we're expecting, particularly when Cornell gets into doing twice weekly surveillance testing, is that we're going to want to have that separated out a bit so we can kind of get the whole picture. What we're working through is whether or not we replicate that on our website or we link to their website. We're still working on that information. What I can tell you is that every positive case, regardless of where it's identified, will be in our county case count. So the total cases will always be a core function of reporting for us as a county. How we break that out, we're still figuring those things out as well. I know that the higher ed groups are planning to report their own positive cases. So we just want to make sure that however we do it, it's clear to the public what the information means. So we're taking our time and trying to make sure we do that right so as not to create unnecessary confusion.
Thank you, Frank.
Okay, I have questions from Ann Corman and Martha Robertson. Annie, would you like to go first?
Sure, thank you. So I have two questions. One is, Frank, you said the higher ed is going to give us their numbers or report those numbers separately. And I know Cornell is doing their own testing, but how about Ithaca College and TC3? Because from what I've heard, they're not doing their own testing. They're going to be done through Cayuga Health, I guess, directly.
So all of the testing is being done in collaboration with Cayuga Health, including what's going on at Cornell. So it's really, yes, it's being done in Cornell's lab and there's a relationship there, but it's all being done essentially with some collaboration with CHS. But to your question about the other colleges, yes, I know I've had specific conversations with Ithaca College, and they have been in communication with Cornell, trying to align as much as possible so the information can be compared and contrasted and is really clear. TC3, I have not had that direct conversation with them yet on what they're planning to do, but we will, and I expect that there will be some amount of data shared there as well.
So we will be able to track from Ithaca College, and we're hoping to do it from TC3 also. I just don't want, us just to focus on just Cornell, right?
Yeah, definitely. That is the plan. I think all three are interested in making sure the public understands what's going on related to their testing.
Thanks. So my second question was for Jason, and maybe you've already been asked this, but could we have get figures on what would be the cost to the county on 12.5% of surveillance testing, and also, I guess I could extrapolate and figure out the 25% ourselves, but if we could have some figures on that.
Yeah, I'll be sending you some information today, Ann. I'll be sending the legislature some more information today.
And thank you. I know you and Frank, I'm sure, have been scrambling and working overtime with all the changes that have been happening. So thank you very much.
So Annie, also one thing that we had talked about in budget was there were a few conversations that went around in regards to that, because as we know, there are some people that can pay for the 12.5%, the $12.50, and I think some of the numbers that were thrown out to us was that this could be to the tune of $1 million for us to cover COVID testing for our constituents. And, it's not that we don't want to do it, because absolutely we would love to do it. And we would love everyone that wants a test and needs a test to feel comfortable coming in and getting one. With us facing an $11 million perhaps deficit, I think we're just trying to make sure that the money that we spend moving forward is really going to be frugal, and we spend our money thoughtful. So it's not that we wouldn't want to do it. And I want to make sure that Robert, if you're still on the phone call, you realize that as well. It's just a conversation that we need to talk about a little bit more. Speaking of, Budget Chair Martha Robertson is here with a question. Welcome, Martha.
Hi, thanks very much for letting me I have a comment and a question. Comment is how complicated it is to say this is the Cornell community or this is the IC community, because faculty and staff have been here all through and they are part of the Cornell and IC communities, but also permanent residents. So, I think just for us all to recognize that we really are one community. A quick question for Frank and then a money question for Jason. So is it true that all communicable, the way I understand it is that all communicable diseases do have to be reported to the health department and then from you up to the state? Is that typical, whether it's STDs or COVID or whatever? Is that right?
Yeah, so it's not from us to the state. All communicable diseases are required to be reported into a system called ECLARS, ECLRS, and I'm not going to tell you what it stands for right now. I apologize, but labs and physicians' offices are required to report those communicable diseases through that database, and then that information gets alerts to us based on county of residence, and the state has access, obviously, because it's a state database.
Okay. And then, Jason, we've done a lot of spending, but I know you're tracking a lot of expenses for a FEMA reimbursement request at some point. We've gotten some money from the CARES Act for contact tracing. Maybe it's a big conversation, but if you can give us a summary of what kinds of expenses will get covered and reimbursed, even if we have to put the outlay out first.
Sure. So we'll give an updated number at the Tuesday's meeting on the total expenditures, but I think it was up to $300,000 or $400,000 range last time around. And so there are several funding sources that I can talk about. One is early on, Frank, I believe you got some funding through CDC, about 150,000 or so, that was primarily used for nursing staff, some for staffing, but I believe we did purchase the Rheonics equipment from that funding because it was guaranteed, and there was a question at the time as to whether or not FEMA would have reimbursed for the Rheonics equipment. So I believe that was purchased out of that 150 allotment. That went pretty quick because it supported staffing. Then there's the most recent announcement of $300,000 that I believe we got from the state through the CARES Act. And that is primarily, that can only add to our contact tracing capacity. It cannot offset existing costs. So Frank right now is looking at contracting out or having contracts readily available. So should we need more local contact tracers, he has the ability to contract out for that service. So it can't offset our existing costs. It can only hire more and more than what we have. So that, it helps us in terms of building capacity and the response. It doesn't help us in offsetting our costs. And then the last piece of the puzzle, as was mentioned earlier, is FEMA's reimbursement. So FEMA generally, this is a federal disaster declaration. FEMA generally would reimburse for 75% of the costs related to certain thresholds. We will definitely we've exceeded those thresholds. In most instances in the past, the state would then chip in another 12.5%. So the local share is not 25, it's 12.5%. So we have, and I'll send this information to the legislature later today when we sum it up a little bit more, but essentially FEMA has confirmed that you can you can enter into contracts with providers for community surveillance testing, and that can be reimbursed at the 75% threshold. And then when a determination is made by the state, we could submit again for the remaining 12.5. The difference here is that we would be fronting, obviously, the cash outlay for it pending reimbursement. So fine tuning some of that information now before we send it out to the group, but that's primarily the three funding sources that we're aware of. There has not been really any direct, sadly, the CARES Act in response to a global pandemic has really not sent any public health money towards us, for that matter. The local public health department on the ground responding, we've gotten very little funding to be able to fight the global pandemic, which is somewhat concerning, but that's another issue for another day. But that's the primary funding sources that we've seen and experienced so far. And we'll be submitting probably our first submittal to FEMA in the next few weeks. And I'll break down a little bit more in granularity things that can be reimbursed. So for example, what can't be reimbursed is time that you would normally be paying someone to work. So for example, if someone is working during this time, they can't get paid, we can't get reimbursement for that. However, there is opportunity, depending on certain circumstances, that if we were to have to redirect the staff to fully commit their time towards this, there could be some reimbursement sought in that. So there's some determinations to be made there. Time and a half, meaning overtime, could be reimbursed at 75%. Certain materials and supplies could be reimbursed at 75%. One thing that has come down as a directive that will not be reimbursed is just the general purchase of telecommunications equipment. So what happened is people have gone out and purchased and expanded their remote work capability due to this. If you didn't have it and it isn't replacing an in-kind existing telecommunication piece of equipment, it won't be reimbursed. And so like there are certain nuances that keep, the rules, I don't say that they're changing, but they're definitely being more refined as we go on in this. So, and there's a variety of different costs that we have, that we're tracking that will be submitted, and most of it will be reimbursed, some of it won't. There's one piece that I have left out on accident that's related to this. Part of the CARES funding that, part of our transportation funding that we got, there's a small portion of it that is being committed to and has been committed to paying for the transportation costs for those with transportation barriers to getting tested. We worked out an arrangement with some local cab companies to create a safe way of transporting folks, as well as with Gadabout, of transporting folks who did not have the means to get to testing. So that's a small carve out of costs that are covered through that component. So that's kind of a little bit of an understanding of the different sources.
Okay, thanks very much. Appreciate it.
Great. And I just have one question to follow up on the transportation. Will that funding also cover whenever our young children go back to school in the fall, if there is a child that's, say, out of school and has symptoms of COVID, if their parents do not have transportation, would that funding cover picking up the parent, then picking up the student, taking them to testing and returning them home?
It's a good question. For the most part, the schools and the parents will be responsible for transporting their children. That said, no child will go without being transported if there's nothing else available. So we will work as we have with anybody else, whether it's isolation. If there are absolutely no other methods, we will be the final fallback. That said, the parents and the school districts have a responsibility to make it a valid effort to try to get those students to testing event.
Okay, great, thank you. Are there any other questions? I do not see any other hands. Great, thank you, Jason and Frank. We're going to move forward to the Office for the Aging. We have a resolution here, and it's Grant Acceptance, Family First Coronavirus Response Act and Coronavirus Aid Relief and Economic Security Act, Office for the Aging, ID 9458. Can I have a mover, please? Moved by Deborah, seconded by Amanda. And Lisa Monroe, welcome to our meeting. Would you be able to talk a little bit to this resolution?
Sure. Can you hear me okay?
Yeah.
Okay, great. Yeah, so this funding, really what we've done with it, under the major disaster declaration, the money was actually could be gone in 90 days if we didn't use it, if the major disaster declaration ended. So we went ahead and tried to supplant some of the overmatched county funds to make sure our subcontractors had what they needed in anticipation of cuts, particularly FoodNet, Meals on Wheels, not only to assist with that, but they increased their capacity a little bit as far as meals served and clients served, because the congregate meal clients now became home delivered meal clients because there's no congregate sites. So the clients went up about 15% from last June, and their meals went up about 26% of what they had put out from the June 2019. We also used some of the funding to set us up with technology, kind of along with what Jason was just saying. So the FEMA money doesn't cover that, but this money was given to us with the flexibility to be able to do things like that. A lot of my staff couldn't work from home because we didn't have laptops and whatnot. We also helped Lifelong, the senior center, which basically closed down because of the pandemic. So we set them up with some ability to work virtually also. And some basic things for our office to set us up so we could have hand sanitizer and socially distance and things like that. And we still are anticipating spending a little bit more, but that's basically what we were able to do with it.
Great. Are there any questions from committee members? Any questions from other legislators? I do not see. Deborah.
Yeah, I just want to be sure. I noticed in the resolution that the bulk of this money went to the contractors.
Mm-hmm.
I'm assuming that would be FoodNet and Meals on Wheels then, Lisa?
Yes, about 150,000 went to FoodNet. And the other contractor was lifelong. So the bulk of whatever that was.
Yeah, it was
Yeah.
157. Thank you.
Yes, that's it. 7,000 to lifelong.
Great. Thank you very much. Okay, let's do a roll call. Dan Klein,
Yes.
Amanda Champion,
Yes.
Glenn Morey,
Yes.
Deborah Dawson,
Yes.
and I will vote yes as well. Thank you all. That was a unanimous vote in support of this resolution. Okay, number 8 on our agenda is the Human Rights Commission. And again, I would like to thank our commissioners that are here today. I think before, whenever I welcomed our commissioners, I didn't see Kathy Jett. She was on the next page. So welcome Kathy Jett to our meeting, who's also a commissioner. And I am going to pass the floor to Payee Kathleen and Kathy Jett. And let me make sure I'm not missing, and Ruth. I just want everyone to know that these commissioners have worked so hard on this statement. And I mean, this product is just really incredible in my mind. And I'm really proud of the fact that they reached out to Kit Gephardt, the commissioner of DSS. They reached out to our sheriff, and they also reached out to Ithaca Police. And we had that conversation, and at times it was uncomfortable last week, but we worked through it. And it was just really nice that all of you came to the table. You worked hard, and it was nice to see the buy-in of our community partners. So thank you all for being here, and thank you for doing the hard work. So the floor is yours. Thank you.
Thanks, Shauna. So we had sort of talked a little bit before. I guess I'm going to actually start off and just give you guys a little bit of an overview of how we envision this document, what its purpose is. I think Payee will talk a little bit about the details, especially as it relates to the human services component. And then Ruth will give everybody an update on our meeting last week with the Sheriff's Office and with Ithaca Police Department. And then, of course, Kathy's here, so she can jump in as well. So thank you, everybody, for having us. We appreciate you taking the time to receive our proposed statement and letting us explain it. So we understand as members of the Human Rights Commission that we're here to help bring issues to the attention of the legislature. We know the limits of sort of our mandate. We don't have policy-making authority, but we view this statement really as a document that the community could rally around. We want it to be something that the Sheriff's Office and the Police Department and members of the community, anybody who's involved with policing concerns or health and human services concerns can rally around and look at this as sort of a template of concrete actions that we can take in our particular roles, whether it's as lawmakers or police officers or what have you. It's pretty broad. Those of you who have read it will see that there are some concrete recommendations. There are also some recommendations that have to do with national policy and international human rights. But it's our view that it's sort of up to the legislature to find ways to move the most important and most time critical aspects of this document forward. And certainly we're here to help you do that. Some of the recommendations we make refer to laws that have already been passed at the state level. The STAT Act, for example, that deals with more comprehensive police reporting, more information about the demographics of the people that police are interacting with, a repeal of a law that kept police department disciplinary records hidden. Some of those things, some of those actions have already been taken at the state level. So we would envision that our focus here locally would be figuring out ways to make sure that those laws are implemented in the most robust way possible. Other issues involve things that we can do locally, increase diversity, hiring initiatives, and whatnot. But we can also get into those details during the question and answer period. So with that, I will pass it on to Payee to talk a little bit about the social services aspect.
Thank you so much, Kathy. And thank you for having us, everyone. Particularly want to say a big thank you to Shauna for working with us through this process and being at our meetings I think that has helped us to structure this as a statement that is primarily, I think, of greatest value to us as a commission. And I think it's important to emphasize that this statement is a statement by the Human Rights Commission that helps us to also articulate what is our role at a time like this, in both looking back at what has happened in the past, but also helping to facilitate the building of a community to which people really know that they belong, and in which Black people, people of color, are free from all forms of racist violence and injustices. So this, I think, the best way to think about this statement is in its three parts. The first part of the statement is structured as a little preamble that gives a sense of the background prompting the writing of this statement and what it is that we're trying to address. The second part, which we simply titled A, Section A, is really about the Human Rights Commission itself. So you can see the language is not very legislative. The ABC, it's kind of more college-based numbering. But the A portion is really looking at the Human Rights Commission. We wanted to ask ourselves the question, what do we do as a commission before talking to the police, before talking to other agencies? How do we ourselves stand at this critical juncture in the national history and in our local history in creating a plan of action that really looks at how we can support the work of various agencies to help them in their work of eradicating discrimination and inequities. And so here we go back and through our different teams, task groups that we have, are looking at how to work through our surveys in getting the kind of feedback that might be of value to agencies and to the legislator, creating recommendations that can help us in moving forward, and working to host various forums that can concretely actualize these principles. And in the second section is where we look very soberly at the fact that it doesn't matter what we do still need to look at how different critical agencies can work towards making these changes and to support that and to encourage that to happen. And so Kathy spoke about, in some ways, a big emphasis was on anti-Black violence in terms of experiences of violence by law enforcement agencies, but also by other social groups. And so I'm going to leave the law enforcement conversation a little bit now, and we can focus on that during the Q&A, but to also talk about how we looked at other agencies that I think really at the heart of how people experience violence, in the sense that you don't always experience violence by encounter with a police officer. Sometimes it's through CPS, what it means for a young person to find that they feel marginalized or don't have their voice. They're not aware of the ways of reporting when they experience an unfair treatment. And so this is where we encourage transparency and community oversight regarding the operations of some of these social services. And it was wonderful to have a chance to discuss some of these recommendations and issues with Kit, the Commissioner of DSS, Department of Social Services. We also are recommending advocacy and legal support for those in vulnerable domestic situations. Before this, we actually had conversations with the Advocacy Center in trying to understand how people are actually facing these challenges when they have to go to the courts, what is available. And some of this comes from our own personal experience in working with women who are women and other vulnerable people in domestic abuse situations. Wanted to look at the school, disciplinary structures in the school. How do we prevent profiling in the school system? How do we ensure that there's community oversight to ensure that Black kids are not immediately profiled right from the school system in a way that misunderstands the cultural expressions of who they are and is misunderstood within the larger system I have often had to appear in the school system on behalf of a young person. And because of my presence there, have found that the disciplinary structure is then made more meaningful and responsive to exactly what the young person needed. This is very important if we are to reduce the likelihood of violence that people experience, Black people experience in our community. And finally, we looked at the possibility of looking at an alternative to incarceration programming. We were not pretending that we had the final solution, but we were recommending a sustained commitment towards looking and engaging it. How do we ensure that people with mental health issues do not have their first experience through law enforcement or policing? And we were happy to find that, there was a positive response by some of the law enforcement officers we spoke to looking at these alternatives. And so I'll stop there and wait for a discussion later on. Thank you. Ruth?
Hi, Ruth, you're still, there we go.
Here I am. Last Wednesday, our Human Rights Commission, as you've heard, met with 4 important people in the community: the Sheriff Osborne, his under sheriff, Jennifer Olin, and Commissioner Kip Kephart. And the chief was not able to come. He sent Officer Jolie. So as we asked each of them what their response was to our statement, they expressed support. Sheriff Osborne said it was well written and comprehensive. Officer Jolie thanked us for doing it. Commissioner Kephart has approved a draft and was also reading the final draft. So we got a sense of support for the statement from each of them. We also heard from each of them hopeful words about the changes which they propose to make. And we asked them many questions. They included questions about community involvement. Sheriff Osborne admitted that that was going more slowly than he had hoped. We asked them questions about how the task force that has the mayor and Jason Molino and Sheriff Osborne is going. That also, the response was that that's going more slowly than was hoped. So there's work to be done. We had a lot of assurance that these agencies want to listen to the community and hear them. And that's what we will try to help with as the Human Rights Commission, as Pei has noted, in doing outreach and hearing what people have to say. I found as I listened during the 2 hours, and I took 6 pages of handwritten notes, so there was a lot of information. What I sensed was beginning was sort of a description of all the good things that they're doing. As we got towards the end, particularly Sheriff Osborne and Under Sheriff Olin were willing to talk about their own evolution in understanding the structural racism in our culture. So that's the kind of change that we're hoping for. That's what we're encouraging all of us to keep working on. Thank you for having us today.
Great, thank you, Ruth. Okay, why don't we open it up to questions? I believe the document was sent out this morning to all of the legislators. And I just want to see if there are any questions from anyone. Amanda, I see your hand up, and then Deborah.
Well, mostly I just want to say thank you also for working on this, and I also felt like it was very, very thorough, and I was pleased to see the action items and really spelling out what the commission wants to do, but what the community can do. And I think something this legislature has needed for a long time is that kind of support and that advice, and that's what you all are there for. And so I really appreciated reading it. I don't have any questions at the moment, but I do want to thank you.
Yeah.
Amanda, Deborah, and then Annie Corman.
Yes, thanks, Shauna. I want to thank the commission. It's really exciting to see the results that you all are producing, especially since I was on the selection committee and remember going through the interview process and how difficult it was to make our selections. And it's just good to see that, that you all have returned on our investment 100-fold, actually. Shauna keeps reporting back how well you all work together, and that's very exciting. The only real question I have is, Ruth, you mentioned that the task force and community engagement pieces were in the assessment of the people that you interviewed going more slowly than was desirable. Was it your sense that that was because the pandemic is restricting people from working together, or was there some other piece of this that's in the way?
That's a good question, Deborah, and not one that we followed up with. And it would be good if you did follow up with that. Yeah, thank you.
Thanks.
Thank you so much.
Pass back.
I thought that was a smart measure, a strategy with Ruth.
Yeah, right.
She's a politician. But I think reading from the other bits of conversation that occurred, not directly in line with that question, I got the sense that what a couple of things had happened. I think one was going slowly because of internal issues that they had to walk through themselves. And I think the sheriff was very candid in the process of working through some issues, which I think Ruth put diplomatically as the evolution of the process. And then there was obviously the COVID, and there was a lot of conversation about the impact of the COVID lockdown. But I think the deputy chief, Jolly, did speak about the challenge of building trust with the community, and that some of these things involved trust. And it seemed to me that they were kind of stumped a little bit on the way forward of moving forward in how do you build trust. And so they spoke about a couple of efforts of outreach they had had. And I think there was a sense of a need for avenue of how do we move forward to move past the ways in which the past has affected them. And this was very useful, I think, for me to hear that, because we certainly knew that there was a trust crisis, but it was good to hear the sense of an acknowledgement that there was a need for help in that area. And I think it opens up doors for us to think about how do we do that and how do we build on that? So thank you for that question.
Well, I do think too that not in defense of law enforcement, but just understanding that they must feel that they're under attack.
That's right.
And that makes it even more difficult.
Mm-hmm. Mm-hmm.
Yeah, Sheriff Osborne noted that is a tendency with law enforcement, as I guess any of us human beings, when we feel that we're being criticized, to be defensive. But there's a recognition that that happens. And so that gives hope that we can move beyond that defensiveness and look at what changes can be made.
Great, thank you.
Can I
Go
can
ahead.
I add,
Yep.
if there's no more questions? And I would just add, a couple things. I want to be clear about the purpose of that meeting that we had with law enforcement. And we have been commissioned as a commission for about a year. But there have, and some of us have been involved in changing police practices before the commission, and we are still involved in some of that. But as far as us acting, unified as a body, the meeting really was an opportunity for us to get together and have a discussion. So we wanted to hear what their perspective was. It was not a venue where it was not the right venue to interrogate what they were telling us. We asked questions and followed up if something was unclear, but it wasn't, we weren't cross-examining anybody. We wanted to kind of see what their position was to the community. What were they willing to present to the community as their buy-in going forward to make things better. Things are not fantastic. I think we need to acknowledge that. And we are talking about two different police departments. We have a sheriff's department and we have a city police department, and those two entities might work together and be aligned on certain objectives, but they seem to be very different on when it comes to addressing particular issues, and those things need to be addressed in the appropriate forum. I don't want to gloss over that and leave the impression with any of you that, we all think everything is great now that we had this meeting. It was clearly just a first step. You all as lawmakers can follow up, community members will follow up, we will continue to follow up. But I just wanted to say that. As far as the question of kind of what's the roadblock to progress, whether or not COVID-19 has, stalled things, Ruth's absolutely right. Like, we didn't ask that question and it certainly needs to be asked. But I do think it's important to articulate that, any lack of progress on policing that is attributed to COVID-19 can also be a consequence of anti-Black policing, to the extent that we are or are not addressing the particular ways that the pandemic hits Black communities and communities of color. And we did not get into that. Again, we did not, interrogate them and look closely at their policies, but I think we need to think of those things as interrelated.
Great. Thank you, Kathy. I want to hop to Jason Molino, and then I still have Annie and Martha that would like to comment as well.
Sure. I just want to comment on where we are with police reform discussions. And we've made a valid effort to partner between the county and the city as we start to get into multiple facets of community engagement. And this is part of it is around complying with the governor's executive order of 203, and part of it is really setting a foundation as we move forward. So, we spend a lot of time discussing process and how to approach things from a community-based approach, and I suspect in the next few weeks we'll be able to talk more openly and start to begin some of those community conversations. It's been an issue of balancing process. It's been an issue of getting partners together, balancing the COVID response on top of it, as well as preparing a budget. So there isn't any particular reason on why it hasn't happened more quickly, other than we're trying to align all our partners and start the planning process. That's all. I just want to respond to that question.
Great, thank you, Jason. Next is Annie Corman.
Hi, thank you. So I haven't had a chance this morning to thoroughly read through the statement, but what I have been able to go through quickly, it looks really good. So I'll definitely take some time and read through this. And So one thing I just wanted to mention was that for me, it was really useful even to come in for part of your the Human Rights Commission meeting the last time and see what you guys were doing. And I'm just thinking about, especially now, but maybe on an ongoing basis, trying to figure out where, as chair of the Workforce Diversity and Inclusion Committee, like where some things with our departments overlap with the with what we're doing in our committee. So, and also then when we onboard very soon, or hopefully very soon, our Chief Equity Diversity Officer. So I just wondering if it would make sense for me to just attend. I don't mean to be participating, but just to, if I could tune into your meetings for a while. And as, especially over the next couple of months, as we figure out how to interact, how we figure out who does what and how we can each support each other in what we're doing.
Great. Thank you, Anne.
I think that would be wonderful. Thank you, Anne. I think it's most appropriate, and you would certainly be very welcome. I think I can speak for all the commission when I say would actually welcome that very much. So thank you.
Thank you very much.
Mm-hmm.
Okay, Martha's next.
Yeah, thank you. Mostly my question, Kathy answered my question. I was going to see if you were talking about following up specifically with Chief Nair at IPD, since he wasn't actually able to attend the earlier discussion. We're working with all the other, like, village law enforcement as well in the reform task force that Jason mentioned, but clearly IPD is, well, the elephant in the room, and their force is larger than ours. And I think people really do identify IPD as the police, maybe even more than the sheriff's department. So you will be following up with Chief Nair?
Yeah, I think we need to talk about, as a commission, the best way to move forward. His absence was noted. Yeah, so we want to be productive, but also be realistic and help create a public record so that progress can be applauded and the lack of progress can be held accountable. So we need to think about the best way to do that within our role as commissioners.
Mm-hmm. Okay, thanks very much. And again, like everybody else, I thank you and really appreciate the work that you've put into this.
Thank you.
Great. I see no other comments or questions. Reverend Ken.
I just wanted to applaud the commission for the work that they've done over these last several months in developing this document. I think it is an excellent document and an important place to begin a public engagement and discourse around issues of racism and the nature of the interactions between law enforcement and communities of color. I mean, one of the things that struck me in our conversation today in terms of talking about the difference of cultures between, say, the sheriff's office and IPD, I think, it's an important note to acknowledge. And also, too, I think it, too, lends itself to the question how, what assistance can the commission, can this office, and others provide to help to facilitate that shift of cultures? What best practices of, say, similar agencies around the country can we explore that might be helpful toward that end? And so I think, this presents an opportunity to really do some exploration and collaboration to, in terms of moving things forward. And I'm grateful to the commission for really starting that ball rolling and beginning to move things forward in a way in which does reflect, as Kathy said, ways in which we can applaud progress and in ways in which we need to, encourage further progress in other areas.
Great. Thank you very much, Reverend Ken. Thank you again to the commissioners. You are certainly welcome to stay for the rest of the meeting. I can't say it's going to be the highlight of your day. I think that's probably already happened. But I wanted to thank you for your time and your effort on this. We really do appreciate it.
Thank you for having us.
Thank you so much. I'll probably leave you to the rest of your deliberations.
Have a great day.
Take care.
Take care. Thank you. Okay, we're now to the portion of departmental updates. Why don't we start with Mr. J.R. Claiborne, Director of Veteran Services. And J.R., oh, there we go.
There we go. Had to find my button here. All right. Hello, everybody.
Hi, JR.
Hi. Thank you. Just a few things here I have for updates. Well, one is I'm still trying to get my head sorted out. I've spent 2 of the last 3 weeks in trainings, both from the state level. So I've got a lot to sort out over my head to get things done right. But I definitely learned a lot over that time. The mental health first aid for veterans and their families, of course, I told you about last time was coming. We did that at the start of the month, and we had 6 participants show. We had limited to 10. Had a couple who had to back out, but we did have the course. We had our social distancing, had the room worked out just right, and everything went well. And I just want to say thank you to our publicly to our instructor, who was Elizabeth Golden, who is a licensed marriage and family therapist locally. Also, the Kiwanis Club of Ithaca donated some pastries for us, and COFA gave us the use of some of their tech equipment, so that really helped everything come together just right. Also want to add that the Veterans Coffee House and the Warrior Writers, where I continue to sponsor those. The Virtual Veterans Coffee House, we normally meet the first and third Thursdays. This month, we didn't have it the first week because of the mental health first aid class, but we will be back on this Thursday from noon to 2. And also the Warrior Writers will not be held the rest of this month because everybody just want to take a break, and we'll resume on September 10th in the evening. And if anybody wants the links to these, please let me know. And then something on a new end, there's a program called Fresh Connects, which is done in collaboration with the State Agriculture and Markets, as well as the State's Division of Veteran Services. And they have vouchers that they're making available for veterans, service members, and their families, their immediate families. This is something you can reach out to me to get the acceptance form, the packet request and acceptance form. And you'll get, once it's returned, you'll get a packet of vouchers within hopefully 2 weeks from the state. And that runs through December 31st, through the end of the year, but they are on a first come, first served basis. And that's all I have right now.
Great. What are the vouchers for, JR?
Oh, thank you. These are for the farmers market. So similar to the farmers market coupons that I know COFA's been giving out in some other places. So these are similar, and they're for farmers markets throughout the county.
Wow, that's awesome. That's really great. Great. I actually was driving the other day and heard there was an ad for mental health for veterans on the radio. And I heard it a few times. So it was good to hear that message is going out on the airwaves. It was, I guess it was a program called Reach.
Oh, that's new.
Yeah.
I saw the commercial, yes.
Yeah, so I'm glad that, I think for so long there's needed to be a focus on mental health and veterans because it's a real problem. And I think there's never been enough money. And I think also there's almost a mindset that we shouldn't talk about it. So I'm glad to hear that people are starting to talk about it. And I do hope that we see increased funding because helping people that are struggling with mental health issues doesn't come free. So thank you for the work you're doing. And We really appreciate it. Are there any questions? Deborah?
Yeah, thanks, Shauna, and thank you, JR. I know that you haven't been at this for a very long time, or you hadn't been at it for a very long time before the pandemic hit us, but I was wondering if there made it vastly more difficult to reach a lot of the people you need to reach, because if they're homeless or, you know, somehow otherwise impaired, they may not have access to computer equipment. Do you have any sense of who's falling through the cracks?
Well, I've definitely seen, well, it's been on an ebb and flow, but it's been more of an ebb since we've had the whole shutdown. But especially since our doors are closed, because normally a lot of people kind of just walk in. But I do have some phone calls. I do get calls occasionally from the agencies. I have not, but I am working on something that hopefully we'll be able to talk about within a couple of months more, where we can try and get a better flow of communication between what's happening to answer your question. But right now, pretty much I haven't gotten a lot of people who reach out to me, but I do on occasion. There are more people who are looking for opportunities to try and serve our veterans community.
Well, that's good.
Yes.
Great, thank you. Okay, I see no other questions. Thank you very much, JR.
Thank you.
Next on my screen, I have Kathy Schlaughter. Kathy, would you like to give us an update?
Yeah, hi folks. Nothing much going on right now. This tends to traditionally be a fairly slow time. There's not a lot to respond. Agencies are pretty much still just waiting for a word from the state about any impact it's going to have on their budgets. We do plan on doing a survey in the next couple of weeks of agencies to see where they are, how they intend to move forward. We've been able to put consultants into about 20 to 25 agencies to help them with planning going forward. And even at our place, our 211 calls are down a little bit, not down from the 50% increase they have, but down a little from the 50%, not down from what they would be last year at this time, but down from the high. We expect they will go back up again as the students come back in and people start having questions, and hopefully we won't see a huge increase in cases, but if we do. So we're hanging in there, and things are going pretty well right now. Thanks.
Great. Thank you, Kathy. Are there any questions for Kathy? Okay, I see no hands. Thank you very much, Kathy. Reverend Ken, from Director of the Office of Human Rights.
Okay, sure. Just a few things. As we were talking about policing, I have been involved in the with the county committee, with Jason and with others, which is exploring the reinvention of policing. We've had one meeting so far, and I'm looking forward to continuing that work, you know, as it moves along. Also, over the last month, and actually even beyond last month, I was involved as the chief editor of the Executive Exchange document, which was produced by a number of nonprofit leaders that we have been meeting on a monthly basis. And we sent that document out to a broad spectrum of nonprofit organizations in addressing issues of racism and other forms of social justice, which was sent out probably a few weeks ago, about 2 weeks ago, I guess. And I was asked to serve as chief editor for that document. We are in process of planning our programming for the remainder of the year. And you know, right now, inquiries have been fairly steady, you know, over this last month or so. And not quite back to where they were pre-pandemic, but better than what they had been in the early months of the pandemic. We were able to welcome Lourdes Cabrera back to work with us and helping us out with education outreach efforts. This month, or rather this week, she is filling in for Carmen, who's on vacation. Carmen Arroyo, our receptionist. And so that's just some of what's been going on with us.
Great, thank you. Are there any questions? Deborah.
Yeah, sorry. I always have questions. Ken, I'm curious. I don't know how much of your business is, people calling in with problems or walking in with problems versus the programming and proactive stuff that you've mentioned. I just wondered how your number of inquiries and public problems, I guess, compares during the pandemic to before the pandemic.
Well, the walk-ins are not as steady as they had been. We are, even when we do have walk-ins, for example, and if people want to make appointments, we do the appointments by phone. Just given our space right now, we just want to take extra precaution. Though we do have supplies available, but at this juncture, with things as they are, we prefer to, if people walk in and they want to express concerns, and we set up phone appointments and then facilitate the filing of complaints if the concern warrants a complaint filing. So it's not at pre-quarantine levels in terms of the walk-ins. In terms of the programming, programming has been a little bit slow, but we're starting to pick up the pace on that in terms of our planning and sort of planning ahead to utilize this wonderful instrument we spend a great deal of our lives on now, Zoom, to provide those programs. So,
yes. Oh, sorry.
Oh, no, go ahead.
No, so I'm curious how many, they don't need to walk in person, but how many complaints has the office handled during this last, say, 6 months?
I would have to go back and look at the exact numbers. I know that they are relatively, small by comparison. I don't want to hazard a number. I need to look at the hard data and give you a more accurate description, which I can provide for you.
That would be good. And that would include the ones that you arrange for phone interviews.
Yes.
Okay, thanks. We'll look forward to that.
Sure.
Great. Are there any other questions? Okay, thank you very much, Reverend Ken.
Mm-hmm.
Next, we have Kate Shanks Booth, who is the Director of Youth Services. Thank you for joining us.
Hello, everyone. How are you guys? Just a couple things. So we have, as everyone knows, the school districts are getting ready to reopen. Every district has their different plans. Some of them are doing AM, PM, some are doing cohorts Monday, Tuesday, Thursday, Friday. And so what we know for sure is that the SAC programs, the school age programs that are licensed through OCFS and the Daycare Council, there's about 9 of them, I believe, are going to be allowed in the buildings. And so what we are trying to do is work with Rural Youth Services, CCE, Ithaca Youth Bureau, and just other providers of youth development to create sort of a list of questions that they may be able to have to go and ask the school districts. Right now, everyone is sort of just trying to get the doors open. And like I mentioned, they're only going to let those particular few school district programs in the school age programs. One of the big issues for them is that because they want the cohorts to remain pretty stagnant in the schools, some schools are requiring that the after school programs also have their groups be stagnant. So that's interesting. It also depends on how many people are going to be doing the in-person versus the online option. What we've heard is that a couple of programs, some of the larger ones, typically run between 80 and 90 kids a day, are really looking between 20 and 25 kids. And so some of them are deciding if they're still going to be opening. Is it really cost prohibitive to open the doors? So we're just trying to keep our ear to the ground and make sure that we're providing large scale conversations, bringing everybody to the table, and to be as supportive as we can while everyone's still kind of up in the air until schools get started. So that is really kind of what is taking precedence for us right now. We're also, due to retirement and reassignment of staff, we're down to 3 full-time people. And so we are taking stock of, we're getting ready for the 2021 budget, looking at our priorities, seeing what funds we have available, and things such as training. So one of the things that we're looking at is a lady by the name of Samantha Lushtak, who she is, I think she owns, it's the Absolute Environmental Health and Safety Consulting and Support Services. She went through, we got her name through Carrie Phillips at GIAC. She went through with them and did sort of a safety training, how to do social distance, how to wear masks, really just some hands-on things. And so we're really, I think it was September the 17th, we were going to be doing a Zoom training with her to see how that's going to go, and providers who are interested to sort of bring as many resources to them as we can. And if it turns out to be okay, we may do a second series of that and offer it to some of the school district folks, really trying to make sure that we're bringing in some resources to give them ideas, and really using that feedback from that and also kind of understanding when the school's open, what that looks like for specific training that we might be able to offer to some different communities that we typically don't touch, but make sure that we are doing the things we can to support them. And the last thing we found out, I had a meeting last week with the New York State Associations of Youth Bureaus. You might have remembered me talking a few months ago about the Governor's Youth Council. That money has apparently been swept. That was apparently done late May, early June. And we did not find out about it until about a couple of weeks ago. And so that has been put on hold, and we are waiting to see whether the funding is going to come through for part of that. There was a young lady out of Dryden. She's a senior there that was selected as our local youth rep. We have not been able to announce that or really do anything public with that because the governor's office wanted to be the first to come out and announce those names. And now that that's on hold, we're sort of waiting to see what they let us know. And so that's really what we're doing over here in youth services.
Great. Thank you so much, Kate. Sure. Okay. Lisa, oh, I'm sorry. Questions. Deborah Dawson.
Sorry. Kate, I since I have you and Kathy Schlother together in one place.
Sure.
No. If childcare is considered, if after school care is considered childcare such that these providers can take advantage of whatever childcare funding may come through in the CARES Act or other stimulus programs?
That's a good question. Some of them can. I don't know that all of them can. I think it depends on who they're licensed through. I'd have to read it to look at. Most of the things that I've heard of are the early care programs that have been taking advantage of most of the CARES money and stuff. I haven't seen anything come through with the school age care yet.
My understanding too, Deb, is that they will have had to have served the community for essential workers during that COVID period in order to receive any CARES money. And if they're outside that window, then they don't receive anything.
Well, that sucks.
Yeah.
I mean, because I can honestly say, having been a single mom from the time my daughter was 7 until she was 14, that after school care was really important to me.
Yeah, I think one of the biggest, so there was a conversation, the daycare council facilitated a conversation between Lily, I think it's Talcott, from the school district and those 9 providers. And one of the things that they had mentioned is that the school district apparently has made the statement and continues to make the statement that there is now more after school care available than there was before COVID. And that's just not true and not the case at this point. And so the question is really, before, what does before mean? When everything shut down, yes, there is in fact more care now, but they were already operating at a deficit before COVID hit. And so there's a lot of people, calling and asking for things, but some of those programs just don't even know if they're going to be able to open their doors.
Right. There's not enough enrollment for a lot of them to bother even opening, especially with the increased cost for, the PPE and the cleaning. And I know Sue, I was talking to Sue Dahl, she's very concerned about whether these programs are even going to be around. There's also considerable amount of money, and I can't remember right now how much, in the CARES funding that the state continues not to release. That she is, it's like, we need it now. It's, so I know that's also a big concern.
Yeah, I mean, and just for example, the school Northeast, right? They typically do the 80 to 90 kids. Tracy Robinson up there, she's looking at enrollment at 20 and 25, and it depends on if they have space for the program, right? So, you know, can they share classrooms? Probably not. The school district isn't able to provide barriers. They're not able to provide any sort of cleaning supplies because of restrictions on how they can use taxpayer funds. So a lot of it is individual, those school district principals with principals in those schools talking to the particular program to see if they can get it open.
So are these reduced numbers a result of having to have more space for fewer kids, or are they because people don't want to send their kids to school and after school?
It's both. It's both. Yeah, it's both.
But there are a lot of parents who just are choosing not to send, at least in the fall.
Okay. And just for safety reasons, a lot of those programs are not, if you don't enroll in school for in person, you won't be allowed to use the program simply because of the health concerns. So, you know, when we have like the rural youth services, they're in all the municipalities, right? And so they do a lot of development. Is it possible to maybe, if they're doing programming, can they work with the school district to do classes that may be able to provide some credit for some of these kids? So, but the problem with that is they're not licensed by OCFS. And so they'll be on that second tier of schools, opening the doors to them if and when that comes around. So we're trying to get them as ready as they can be if that option becomes available to move in and continue to do that.
I think also what's hard is that there's been so much talk about equity in our schools, and you know, for a parent that works and they have to send their kid to school in person, and then they have to send their kid to another place, which doubly exposes their kids, you know, to a different pot of kids that are exposed to a different, you know, like for example, my son goes to Northeast Elementary, typically goes to GIAC. Before COVID, no problems. We were very open to that. Now with COVID, I'm like, you know, I don't know if I want my son opening up his pod to, you know, another 20 kids that he could be exposed to. So I think people are questioning how much liability, how much exposure. And, you know, unfortunately, some people really don't have a choice because they need that daycare in order to work. So I want us to continue that conversation because I think for many people, it's a real struggle trying to figure out a balance between paying their bills and making sure that their families are safe. Martha.
Thanks, Shauna. Kate, you said nine after-school programs are planning to open up. Is that what you said?
They're the ones that will be allowed to be in the school. They may choose not to open, or they may be open on a much reduced scale. But those are the ones licensed through OCFS.
Okay. And just for context, how many did we have, you know, in February this year?
So those nine would have been there, but then you're looking at the Ithaca Youth Bureau did programming. Mostly, they're not necessarily childcare, but they do development. The Y has is in some conversations. You know, I mean, you've got primitive pursuits. There's a number of them. Honestly, I'd have to check in, but it's more than 9. Okay. I would say easily 20, if not more.
That would provide something after school, but not necessarily.
Yeah, some be enrichment activities, not necessarily childcare. Some of those are if you're just music, if you're just swimming, it falls into rec, so it's a little different. It's hard to know that number, but there was many more than.
Okay, and this 9, are these throughout the different districts in the
Yes. Yep. So Trumansburg has one. Ithaca City School District has some of those. I think Groton has one. Dryden has one. Yeah. So they're, not in every one, but in several of them. Yes. Most of them are in the city school district, obviously, but there are some outside. So the only school, and if you look at the reopening plans, the only school district that actually mentioned care was Ulysses Trumansburg, which I thought was interesting. And so they are apparently, from what I gathered watching that report from last week, the lady who had typically done the SAC program in Trumansburg she's opening a new program in a local church, and there's going to be a new a new program offered there in this elementary school. So.
Well, I think that's obviously because Jason Molino's kids go to that district. So
sure.
Thanks very much, Kate. Boy, what
Sure.
what a problem. This is just.
Yeah, it's just, it's, you know, kudos to teachers right now and to administrators, and it just, you know, they really hats off to them because it's a mess.
Yeah. Thank you very much.
Yeah.
No other questions. Let's move on to Lisa Monroe.
Hi there again. So yeah, we're still kind of plugging along here, doing virtual appointments, pre-scheduled in-person appointments. As JR had mentioned, the doors are still locked to the public. Something else that JR mentioned is the coupons, the Ag and Market coupons. We do the senior farmers market nutrition program that actually just ended this week. We had to send, I think we had 800 and we went through about 600, and the state likes to get a count of how many are left and order to like reallocate them if they so choose. We may get some back and we're able to get the rest of them out, but at this point, we had to notify them last Friday of what we had done so far. But 600 in this environment right now is not too bad, considering most of our tabling areas didn't happen this year. So we're happy with that. We're gearing up for the heap season right now. We have been working on our Center for Excellence. We had 4 engaged Cornell students, interns that worked with us, and also another student intern that worked with us on research projects and collecting best practices of different organizations during COVID. So they've gathered a lot of information, which is really great. And we're kind of working on some projects with technology. And one of the biggest gaps that we really saw during all of this is that there's seniors that, you know, not only can't use technology, but they can't afford the technology and they don't know how to use what they do have. So we're working with Lifelong and Ithaca College occupational therapists that on a program that the North Country had done with Senior Planet. It is a organization that started in New York City. And they have a branch in the North Country and have done some work. So we've been working with them a little bit to figure out how we can model that same type of thing here. And so we're still in the beginning of stages of it, but it would be a match with people with our project care program. So they would get a student or a friendly visitor that could help them with the technology. They would also end up with that person as a visitor. It would open them up to be able to, visit with their own families, help the social isolation piece of it, and also, open them up to things such as telehealth that they weren't able to do during COVID. So we're working on that right now.
Great, thank you. Are there any questions for Lisa? Amanda.
Hi, thank you, Lisa. I was just wondering about the COFA advisory board and if they're able to still meet right now and how that's going.
Yeah, we have been. We've done 2 Zoom meetings. August is our month off. And they went pretty well. What do you think, Dan?
Yeah, I missed the muffins and coffee, but otherwise they're going very well.
Yes.
Yeah, I missed the muffins and coffee too.
People picked right up on it with no problems, really. I was surprised, but they've been receptive and we've been able to carry them out. Usually in the fall, we do a public hearing. That's going to be a little bit different this year. The state's not requiring us to do one, but we still want to get people's feedback on our plan. So we'll be doing that virtually and probably making some kind of a YouTube video or something for that. So it's been working okay.
Okay, great. Thank you.
Mm-hmm.
Great, thank you very much, Lisa. Any other questions? Okay, I don't think so. Thank you, Lisa. Next is Kit. Hi, Kit.
I'm not going to turn on my camera. We keep losing connection here. We're having some sort of instability with our internet. the state today. So I'm hoping that I can make it through this and not lose you. So things are cooking over here at DSS. We're seeing our caseloads rise in a number of programs with the loss of the additional unemployment benefits that people were receiving. So we are increasingly getting calls that kind of start with people saying, you know, I want to explain to you, I've never called DSS before in my life, and I'm wondering if you can help me. So we're definitely seeing that happening. The general application for temporary assistance is now online. That is something that we have been hoping that the state would put out for a long, long time. The SNAP application became available online a couple of years ago, and Medicaid has been available to apply online since a couple of years ago, but they had not put the temporary assistance application online. You still had to come in and apply in person. And just recently, like 3 weeks ago, became available, maybe not even 2 weeks ago, became available, and we're starting to see applications roll in that way. And it's going to make a huge difference in terms of both how rapidly we can serve people right now, but also it will just make people's lives a whole lot easier. People that are, you know, obviously very reluctant, understandably reluctant right now to come in and apply. It will make that much easier for people, and that will go very nice hand in hand with our mobile document upload, which came online a little bit, just, I don't know, 6 weeks ago through the state. That allows people to upload the supporting documents they have to provide to be able to qualify. And they can now do that through their smartphone that links to an app. So all of those things are really kind of coming together to make services a lot more available more quickly for folks. We're beginning to really do what we've been calling fall COVID planning, or maybe it's COVID fall planning. We're really, you know, so all of this time since all of this stuff hit in March, we have had our front doors closed. We've got somebody screening people outside the building. It is not uncommon at all that we ask people to wait outside right now, have a seat outside, and wait until the lobby is not too full to bring somebody in, or, you know, to interact in a more safe way, or we've actually put a phone out in front of the building that's accessible to people, so, you know, people can actually talk on the phone and process some of their stuff out there. So we know, though, that with fall coming on, we're going to be in a situation pretty quickly where, you know, when it's cold, we're not going to be able to ask folks to wait outside. We have a tremendous number of people that come with small kids, that may be disabled, that may be elders, that we, you know, are not going to be able to stay in the cold. So we're beginning to look at how to plan, and going through a rather elaborate process of trying to think about how we can break up the lobby, how we can utilize some close interview rooms and that kind of stuff without putting people in an unsupervised situation. So it's a significant planning effort that's going on right now. So I think at the next meeting, I'll be talking to folks about the ESG money that I mentioned the last meeting. We've submitted our application. That's the Emergency Solutions Grant through OTDA. It's part of the CARES Act, and we know that our community is slated to receive a pretty significant chunk of money, and we've been planning with a pretty broad group, and this will support a tremendous amount of homelessness, rapid rehousing, eviction prevention, some funding for quarantine. So it's going to cover a broad range of stuff. So as soon as we get notice that we've been approved for that, which I think will come pretty quickly, I will be presenting that. I would anticipate that maybe at the next meeting. So I'll let you know more there, but we're excited. I think that money is going to really help our community. And we are always, but I think especially during these times, we are working very closely with JR and his veterans program to really provide good service to veterans that oftentimes are needing our support at DSS as well. And so we're grateful for his program and for the really specialized support. So oftentimes people come to DSS, we can really get them hooked up with the broader services, but they oftentimes need the more individualized services of a smaller program. And JR has been really working with us around that. So thanks to you, JR. I think that's it for me. There's a lot going on, but we're also, you know, we've had a number of retirements, and we're in the process of looking at filling some key positions before we get too far down the line in the fall, when we expect that things could really start to, I mean, like I said, numbers are rising right now, but I think we're going to continue to see that happen. So we're kind of anticipating getting ready to really be able to serve people in the way they need it. So I think that's it for me. Oh, Shauna, you're muted.
Oh, I love it when I get to laugh at people whenever they do that. So good for me.
See you talking to me. I just couldn't hear you.
So I was wondering, whenever there isn't enough room inside and people have to sit outside, are there chairs that are being provided?
Sure. Yeah. And most of the time, because we've done so much to try to work with people through, you know, phone or even some internet-based kinds of applications when that's possible, we don't typically have, I mean, we're not talking about like, you know, 20 people sitting outside. It's like one person who sometimes is waiting. Most of the time we are bringing people inside. There are occasionally times when there's a risk issue, either for the person or because we, you know, they can't answer no to all of the screening questions. And so we will have them wait outside. We've had not a huge influx, but a steady stream of people that are coming from other states, and sometimes the states that are within that quarantine list. And so we will oftentimes have them wait outside, and we provide a chair, make it as comfortable as we can for people until we can get things settled so that they can, you know, oftentimes we're sending people to the hotel because they're going to quarantine. So it's more that kind of stuff. We are bringing people into our lobby on a regular basis after they go through screening, and especially if they're going to need to wait for a period of time, because, you know, oftentimes it's our homeless population, but there are a couple other scenarios too. So, but we're trying to keep people away from each other as well. So
that's great. Yep. And then the second question I had, I actually delivered lunch to one of the employees upstairs. And
thank you.
Yeah, no, it was my pleasure. And I saw an interaction between someone that was coming in and trying to deal with the staff and the staff. And I know that we did a security assessment almost a year ago, and I was wondering if you could share that assessment with us, if there are some needs that we need to address soon. Because I know I left that after delivering lunch thinking, I didn't necessarily feel safe in that situation. And I mean, it would be nice for us to at least see the recommendations. I know right now it's a horrible budget funding year, and we're probably not moving forward with too many OTRs, but I can imagine if I were in that building for 10 minutes and witnessed that, I'm sure that that's probably happening pretty constantly. So, I mean, it would be great if we could see, you know, what the recommendations are and what the price tag for those were.
Sure. We're so yes, that is something that we have gone through a couple of different, what should I say, a couple different iterations. We've been working with the company that did that report. And so I apologize for the delay on that. So we've gone through that process. We just received a couple weeks ago the final report. And we are currently putting together, so this is kind of timely, Shauna, we're putting together, it's taking a little while to kind of figure out what will things cost, kind of get some estimates, and then I will bring that to this group as soon as I can. So I'll try to reach out to you and let you know. But yes, I think, you know, the other thing I think is that some of the report was done obviously before any of this COVID stuff hit. So I think one of the things we're going to see is that while some things are definitely a need right now, there are going to be other things that I think we won't probably move forward with, just because until our situation changes where we've got the doors closed and security out front, there won't be a need. But we are experiencing a lot of situations. People are, as we all know, people are stressed, and we're seeing a lot of stuff go on both on the external of the building, a lot going on the street, but also, people are stressed and they are struggling right now. And so people tend to have a very hard time. So, yep. So I'll try to bring that to you as soon as I can.
Okay. Yeah.
I'll let you know.
Okay. And again, it was just, I was there for 10 minutes and I just kept thinking, like, gosh, if this was just a little view of what's going on. And in 10 minutes, I saw something that I was uncomfortable with. I want to make sure that our staff feels comfortable coming into work and safe.
Sure.
So it would be great to have that information. Thank you.
Absolutely.
I see Martha, your hand's up.
Yeah, thank you. Hi, Kit. Can you be any more specific about the increase in caseloads?
Well, I will be able to. We're pulling together more specific numbers. I can tell you that last month's CPS numbers looked what we consider much higher. So we typically ride between 80 and 100. 100 is a higher number for our CPS reports coming in a month. Last month we were at 117, I believe, is what it came in at. That might not be the final count, but I think it was pretty close. So we're seeing those numbers rise. I don't have on this call, but we are compiling them as we speak. I don't have exact numbers for TA, HEAP, and SNAP, but I've been getting numbers every week from staff, and they're definitely rising. So I can definitely provide those numbers for you shortly, because we know that they're going up. Our call volume is definitely going up.
Right. And if we could get
Shauna, this is Matt Becker from the.
Sorry about that.
If we could get as current information as possible, did you say that you saw this sort of suddenly with the loss of the extra unemployment money from the federal government, or you're just seeing a consistent rise?
No, I think that a lot of it is related to the loss of that additional pandemic unemployment benefit. We were seeing increased calls before that went away, but it was really the anxiety of knowing that might not stick around. People were beginning to call, and we're experiencing more and more people that are calling and saying, even those that weren't on the unemployment benefits in some way, people are calling in and saying, I'm moving in with a relative, or I'm living, I'm going home to live with my parents, and I've got 2 kids, and we're having to kind of consolidate because somebody lost their job, or both, mom and dad lost their jobs. So we're seeing that kind of trend and that kind of story coming out of people that are applying. So there's concern there. Yep.
So as in the category, in the frame of trying to use that information to convince our lawmakers in Washington to actually say, look, these are the numbers from just one small community, which is usually a typically relatively well-off community, but we're seeing, this amount of increase would be very helpful in telling the story of what the delay in Washington is doing to real people. So I'd very much appreciate, as current information as you can provide. So.
Sure. I will definitely, I could definitely get you some statistics. The one thing I would caution about, not that I understand how you're going to potentially use it, Martha, the one thing I would caution is that so there's oftentimes as much as a 2-month delay before we get what the state considers the official numbers. So if you talk to them about those numbers and they say, well, those aren't the actual numbers, it may be that they're still revising what they consider, our numbers that go in various categories. But again, it all kind of comes out in the wash that, they may consider these cases going in that category and those cases going in that category, but it'll come out eventually. So just so that you're aware that if somebody pushes back on that, that's what's going on.
Okay, great. All right. Thanks so much. Appreciate it.
Yeah, thank you.
Did it again. Any other questions? I don't see any other hands up. And then our last department chair that's here is Frank Krupa. Would you like to give us an update?
Sure, Shauna. I think we covered most of the public health stuff early, but I would point out that we do have programming at the health department that is up and operational. Early intervention services are fully engaged. We're doing some still virtual, but there are many families that were not being successful with virtual, and so we prioritize them for face-to-face. So our team is continuing to work early intervention services. And they are also still part of the COVID response too. So we're balancing all of those efforts. Environmental health has been doing enforcement, but at the same time doing permitting and other programming. They had their first rabies drive-through clinic this weekend for the animals. We're trying to get back to as many of the services as we can while still doing COVID work. On the mental health side of things, probably two big things of note. The mobile crisis team, effective last Monday, is now back in the field. They did have the opportunity to go in the field previously, but it was rare occasions where they would. Now we've put in some COVID protocols, and so they're back to doing their normal work. And we've also started our first in-person PROS classes. So PROS is personalized recovery-oriented services. They are a classroom-based curriculum, and so they have been meeting with and providing service virtually, but really had some folks that wanted to get back together. So they are using the pyramid room, which is our large room on the first floor. There's a separate entrance. They're using social distancing. The groups are less than 10, and they're no more than an hour. And of course, we're masking and all of those good things. So beginning to try to get some additional expanded face-to-face services there at mental health as well. I think that's all that I have, Shauna.
Great, thank you, Frank. Any questions for Frank? Okay, I don't see any hands. Are there any committee members that have anything they would like to announce or say?
Yeah.
Oh, Dan Klein.
Thank you. At the last couple of meetings, Kate Shank's booth has talked about internet access as something that she was noticing, was a rising issue and wanted to do something about it. She and I talked a little bit. Kate was doing quite a bit of work on gathering together a large meeting of a bunch of stakeholders. In the meantime, I started talking to other people in other towns and discovered that all these people were having this conversation at the same time. None of us exactly know how to proceed in this, but it seemed to me that we should probably be looking at a countywide or possibly a regional-wide approach to the internet access issue, at least to start, to see if that made sense. And so the first conversation that I know of that's going to be happening about this at the county level is next Monday, a week from today, at the PEAK meeting, the Planning, Energy, Environmental Quality Committee meeting, which will be looking at it from the point of view of the planning department, to see whether that's a place where that discussion might originate. Maybe it's not. So I just wanted to mention it because it touches all of the clients that we deal with, and all the programs that are represented here, all the departments that are represented here. So if people have thoughts about this issue about access to broadband internet and how it relates to geography, how it relates to demographics, or how it relates to our programs, I'd be interested in hearing about it. Thank you.
And Dan, I am the rep for TCOG, and I am happy to invite you to one of our meetings there. And you could speak as a guest and, roll out your ideas and start the conversation. I'm happy to talk to the chair about that and see if we could get you some space on the agenda.
Thanks. I know that the towns have been talking to each other. I don't know if they've brought it to the TCOG level or not.
Okay.
Thank you.
Sure. Okay, I see no other hands. Thank you all for attending the meeting today. And
Shauna.
Oh, there's someone else.
Shauna.
Yeah.
Kathy, you still have an appointment in minutes on
We
the
should
agenda?
do. Yeah, you're right, Kathy. Okay, well, let's do that. Let's see here. I have an appointment for Michael Ravinder Kingra to the Board of Health. And typically this is an at-large for the city of Ithaca. And I was on the nominating committee for Mr. Kingra. Can I have a mover? Moved by Deborah, seconded by Glenn. And are there any questions? Okay, I see no. All those in favor of appointing Mr. Kingra to Board of Health? All those in favor, let's do a roll call. Glenn Morey?
Yes.
Deborah Dawson?
Yes.
Amanda Champion?
Yes.
And Dan Klein?
Yes.
Myself, I am a yes, thank you. And let's do the minutes for July 20th. If I could have a mover? Moved by Amanda, seconded by Glenn Morey. Any questions or comments or changes? Nope. All those in favor? Deborah Dawson?
Yes.
Glenn Morey?
Yes.
Amanda Champion?
Yes.
And Dan Klein?
Yes.
Okay. Kathy, did I forget anything this time?
No, I think we're all set now. Thanks.
Okay. Thank you all for attending. Have a great day.
Thank
Thank you, Donna.
Bye.
Everybody.
Bye.